So this is a very, very important question. I've been practicing for almost 26 years now, and I see a major difference in the patients coming earlier and now. Earlier, women would get married at 20, 21, plan to conceive by 22, 23. So they used to have no problems. Pregnancies would happen earlier, babies would be healthier, they would have good weight babies, medical complications in pregnancy would be less. But now I think women are more oriented towards their careers. Every time I have a couple coming and I try to make them aware that, look, you're married at a later age. I think you all should not delay your pregnancy too much, because if you're getting married at 31, 32 and you plan a pregnancy at 34, 4 years, doctor, we need to get to know each other, we need to enjoy our marriage, then we need to settle with our career, then we need to have a finance. I always tell them that, look, you all are missing out. That, as you're aging, we have to understand that for a woman, the number of eggs that she has through her reproductive age is already decided when she is born. The number of eggs are only depleting with every period. So every period we are losing some number of eggs, which we cannot regenerate. Unlike men, semen and sperms in the semen are formed with every few months, or every cycle of the semen or the sperms that are being formed. But with eggs, we cannot do that. With the number of eggs that we had when we delivered ourselves, and when we were babies or newborns, that's the number of eggs that retains for the rest of our reproductive life. And as we age, it is not only the number, it is also the quality of the eggs that is going down. And that is why we tend to start having babies with, congenital abnormalities, low birth weight babies, a lot of medical complications, because the woman's body is also getting old. And that is why blood pressure, diabetes in pregnancy, all these things set in, which we never realized in years earlier, where the women were getting married earlier and having babies at a much younger age. And also, to make it lighter for them, I always tell them that, if you have babies earlier, I think your parents are younger to take care of your children, and then you can go and work post-delivery. And now if you're old, then your parents are old. So you have a double sword to take care of. One side your babies and the other side your parents.